So before Dr. Laura starts, I'm just going to give you the topic. Welcome to everybody who's joining us on social media and to our group. And Dr. Laura is going to be presenting today a paper on the ketogenic diet, using the ketogenic diet as an intervention for metabolic health and psychiatric health in bipolar and schizophrenic cases. So it's going to be it's a quite interesting paper, and Dr. Laura will take it away and do her presentation.
Awesome. Thank you so much. And thank you everybody who is joining us on this Tuesday night. I am Laurie Buchanan. I'm a family medicine doc, as well as board certified in obesity medicine and a metabolic health practitioner. And I'm excited to present our third journal club tonight. And without further ado, I am going to jump right in. All right. So the paper we're going to be discussing today, actually two, but it was published in Psychiatry Research, titled A Ketogenic Diet Intervention on Metabolic and Psychiatric Health in Bipolar and Schizophrenia, a Pilot Trial. So this was published in the last 6 months, and got some really great authors on there. Real quickly, I think Metabolic Mind, which is a newer organization that is really trying to be the forerunner in promoting that mental health is metabolic health. And they are, they're spot on. But I really like this information they had on their website. Decades of scientific evidence suggest that mental illness is rooted in systemic metabolic dysfunction affecting the brain. Ketogenic therapy and other metabolic strategies are emerging as promising new treatments for psychiatric disorders. And we see that in our clinical practice on a regular basis. So a little bit of background. Those with severe mental illness have a decreased life expectancy of anywhere between 10 and 25 years compared with the general population. And this is actually in large part due to premature cardiovascular disease. So again, kind of going that mental health and metabolic health. Recent findings support the idea that psychiatric diseases such as schizophrenia and bipolar illness may have underpinnings in metabolic dysfunction, including cerebral glucose hypometabolism, so the brain not getting access to enough sugar, oxidative stress, as well as mitochondrial and neurotransmitter dysfunction. Developing strategies that target this energy dysfunction may lead to treatment options that improve the psychiatric symptoms of these diseases without causing the side effects that are observed in conventional treatment with neuroleptics. So that's one of the things, unfortunately, we see. These medications can be very helpful for people, but they very often cause significant weight gain, diabetes, mess with the lipid profile, causing high triglycerides, so contribute to metabolic disease. A ketogenic diet provides alternative fuel to the brain aside from glucose and is believed to contain beneficial neuroprotective effects, including stabilization of brain networks and reduction of inflammation and oxidative stress. So those are some of the mechanisms by which it can be helpful, and more research is also ongoing in that area. So the key points from the abstract: this was a 4-month study with 23 individuals who had either bipolar or schizophrenia, and there was no control group. So just like we've done with our prior journal clubs, we're going to be looking at PICO, so the population, intervention, comparison, and outcomes. And this one is a little bit different because it's an intervention trial, just a single arm on a group of patients. So does the study show true cause and effect? We won't be diving quite into as much like we did with the nutritional epidemiology, where there's a lot of flaws with those kinds of studies. And then another question, you kind of just as you're reviewing studies in the back of your head, can the study be journalized to other people? And that's external validity. And in this population, again, we're talking specifically about individuals with bipolar or schizophrenia, and generalizing to other people, you might be thinking about anxiety, depression, or other mood symptoms. The study population, 23 people across the nation. You could be included if you had schizophrenia or bipolar, and you had either you were overweight, had a 5% weight gain, or one more metabolic abnormality, such as insulin resistance, high triglycerides. and you could not join the trial if you had an acute psychiatric condition like mania or thoughts of hurting yourself, pregnancy, anorexia, or severe kidney or liver dysfunction. Briefly, just a little bit about what is bipolar disorder and schizophrenia. Bipolar 1 includes extreme mood swings, and you have to have manic episodes. And manic episodes aren't just, oh, I'm a little bit happy. These people may not sleep for days and days, may go spend a ton of money, do very risky behaviors. So it can be very dangerous and often require hospitalization. Bipolar 2 has hypomanic episodes with depression. Schizophrenia, individuals have psychotic symptoms such as hallucinations or delusions. They also have negative symptoms where they might not feel happiness, or they may have just a kind of a stable affect, not a lot of emotion. And then schizoaffective disorder is individuals who have schizophrenia plus either manic or depressive episodes associated with that. Looking at the study population, there was 5 individuals with schizophrenia, 16 with bipolar. 1 person ended up withdrawing due to relocation, and 1 withdrew as they wanted to follow a vegetarian diet. So we had 21 completers in the study. In the intervention, as this, they initially had an initial screening appointment, and then they had weekly appointments for the first month, spaced out to every 2 weeks, and then eventually to 1 month. They provided educational handouts on how to stay low-carb keto. They were provided with recipes, a personal health coach that would check with them weekly, send messages to help with dietary adherence. The diet recommended of 10% carbohydrates, or about 20 grams of total carbohydrates, excluding fiber, 30% protein and 60% fat, and recommended to eat at minimum 1,200 calories per day. And then they monitored blood ketones weekly. The blood ketone levels that were considered to be in nutritional ketosis are between 0.5 and 5 millimolar. And it was said that the individual was adherent to the ketogenic diet if they had levels in that range more than 80% of the time, semi-adherent between 50 to 79% of the time, and non-adherent if they were in that area less than 50% of the time. So overall, 14 people were adherent and 6 individuals were semi-adherent. So that means 1 individual was not adherent. Looking at the comorbidities, we can see that a large amount of the population, 85%, did have several comorbidities with an elevated BMI. Going into the outcomes, I want to highlight first off that they had an over 11% weight loss of total body weight, so over 25 pounds during that 4-month course. And we know clinically meaningful weight loss from other studies is just at only 5%. That'll provide metabolic benefits. And it seems, as we'll see later on, this is also true for psychiatric concerns as well. Additionally, they only lost about 5% of their skeletal muscle mass, which in the Virta Health study, which was a large trial also using the ketogenic diet to help with diabetes, they found that there was only about a 14% lean mass loss during that 2-year trial, whereas with typical dietary interventions, diet-induced weight loss from lean mass actually is closer to 25%. So it's just beneficial if the weight that you are losing is not coming from your lean mass. Looking at some other biomarkers, I want to highlight the triglycerides dropped significantly by over 25%, almost 25%, so dropped by 46 points. And the HOMA-IR, which is a marker of insulin resistance, also dropped significantly. At baseline, 29% of the population had metabolic syndrome. So that means having at least 3 out of 5 things, those being elevated waist circumference, high triglycerides more than 150, HDL less than 40 or 50 for men or women, or elevated blood sugar and elevated blood pressure. And impressively, at the end of the study, 0% of those individuals had metabolic syndrome. This is a graph that shows a lot of different improvements, and you can see in the group that was adherent, across the board, they did have a little bit stronger results, but the semi-adherent group also had some good results. And I highlighted here the visceral adipose tissue, so the fat around the organs that's more dangerous, dropped by over 35%. Looking at some of the questionnaires they collected on these individuals, the PHQ-9 is a depression screening questionnaire, and at baseline, they had scored a 10 points, which is moderate, and that was cut in half by over 50%, so down to 5 points, which drops into the mild range. The GAD-7, which is looking at anxiety, had almost a 25% improvement. And then in the clinical global impression scale, its score dropped by 1.4, and changes of 1 point are clinically significant. It's a little bit hard to see, but you can see on the severity of illness, the scale goes from 1 being normal, not at all, to 7 among the most extremely ill. And what's really cool when we look at this is looking at the adherent cohort, almost 91% at the end of the study who were adherent had clinical remission. So they had a score of 1. And even in those that were semi-adherent, there is a significant improvement. So 50% had a score of 1. I want to take a couple of minutes to review this prior study, because this is really exciting that we're seeing those kinds of results in individuals who are suffering with some very debilitating mental health conditions. And this was another study that also showed some really impressive results. So in this study, the CGI, the Clinical Global Impression Scale that we were just talking about, improved even more. It went from 4.9 down to 2. And this was in about 30 people with, they call treatment resistant, but basically had been on multiple medications and were actually in an inpatient setting because of the severity of their illness that they were studying. And 12 out of 28, so 43% of these individuals achieved clinical remission during that study. Some of the questionnaires they looked at was the PANS, and what's really impressive here is that dropped by 42 points. 16.5 is clinically significant, and this is scoring looking at psychosis symptoms. And if we compare, that little box that shows is looking at common antipsychotic medications and different doses that are used for psychosis. And depending on the formulation, those had an improvement of about 25 to 31 points. So the ketogenic diet in this population actually had an even greater benefit without some of those side effects I mentioned earlier that can be really tough for people to handle. So highlighting the results in the prior study, the number or dose of psychotropic medications was reduced by 64%. Most people, and similar to this study, had initially just some mild side effects that resolved within a couple of weeks. And the bulk of them experienced no side effects afterward. And again, just to highlight, 12 out of 28 achieved clinical remission. And from this study, we saw 91% achieved clinical remission that adhered to the diet. So these are really impressive, exciting results for this population. I want to go back to the current study and just read some of these quotes out loud, because I think it's really powerful to see the impact that it had on these people's lives. Since being on the diet, I haven't noticed any significant anxiety level or attacks, and I've been able to work through basically everything I've come across. It can honestly save a lot of lives. It saved mine. I would not be here today if it wasn't for keto. It's helped a lot with my mood stabilization. If things continue in a positive trajectory, it's definitely not out of the realm of possibility that my bipolar could go into remission. My opportunity to participate in the metabolic psychiatry study transformed my life. I gained knowledge, became able-bodied again, and my mood disorder and eating disorder symptoms lessened dramatically. I became sexually active again after 16 years of celibacy. I can tell you that I've never felt better than I have since using ketosis. It worked far better than the lamotrigine, a medication commonly used for bipolar, ever did. So just take a second to hear how all of those individuals, these quotes, their lives have been so incredibly improved. And right now, most people with these types of conditions are not offered a ketogenic diet as an option for their treatment. And so we really want to get the word out there and spread that there is, one, we need more research, but that there is this possibility where some people end up trialing medication after medication with differing side effects. In conclusion, taken together, our results show that a ketogenic diet intervention is a feasible and acceptable supplemental treatment to neuroleptic medications in an outpatient real-world cohort showing psychiatric and metabolic health improvements in those with bipolar or schizophrenia illness with comorbid metabolic abnormalities. This was a technical journal club, but at Toward Health, we believe we need to empower people to read studies and then really start getting interested and, again, trying to help get more people passionate about metabolic health, and mental health is metabolic health. I do want to kind of throw this out to everybody. So there was a study that was being done, another study on individuals with schizophrenia that was an inpatient trial using the ketogenic therapy. And this study was shut down, unfortunately, by the Maryland Department of Health. After a 16-week review, they found no health or safety concerns, and the reason to shut down the study was based solely on funding sources, and it was the concerns over privately funded studies on patients who were almost exclusively court committed to the inpatient hospital. But there were safeguards in place and IRB, so institutional review boards, that ensured the individuals were of sound mind. They chose to be a part of the study. They wanted to try these dietary changes. They had the right to drop out at any point in time, and yet they were told to halt the study. So I do encourage you to take the time to go share this, sign to try to get this reversed so that hopefully these individuals might get the opportunity to, in the inpatient hospital setting, get fed healthy, nutritional food and trial a ketogenic diet. And with that, I'll open it up for some questions.
Yeah, thanks, Dr. Laura. I'm going to try to got a couple, but there's one in particular I'll start with that's in our box here. Shelley's asking, do you know why the individuals with liver or kidney issues were not included in the study?
That's a great question. So with severe kidney disease, you might have to be monitoring the amount of protein intake that individuals are doing. It doesn't mean that they can't eat a ketogenic diet. And in fact, there's now some trials ongoing showing that ketogenic diets might be beneficial and even used in polycystic kidney disease. But that could have been something that the authors were not set up to kind of manage, or they didn't have the other doctors or resources in place to track that and monitor that. Same thing with liver disease. But usually, and this is something to work with your doctor, even if you do have some liver disease or kidney disease, you can eat a low carb, healthy diet. Definitely with something, maybe not that is severe, but very regularly we see with individuals who have MAFLD or metabolic associated fatty liver disease, that ketogenic diets actually reverse that.
Thank you for that. And so there's another question being, well, what if an individual has, doesn't necessarily have a diagnosis of anxiety or depression, but is sometimes, experiencing these symptoms? Would you think that there would be a benefit for them to use a ketogenic or low carb diet as an intervention, even though they haven't been diagnosed with that being depressed or anxiety?
Yeah, absolutely. And this is something we see on I would say almost on a daily basis, where people report significant improvements in their mood, improvements in cognitive function, kind of brain fog lessening. Even in individuals who do have clinically diagnosed anxiety or depression, we also see that improve regularly. And we need more larger trials showing that, but absolutely we see that. And we hear about other doctors and talk with other clinicians who also see that regularly. Similarly with women who have a lot of premenstrual dysphoria or premenstrual symptoms that might be impacting their mood, the low carb keto has caused improvement in those symptoms as well.
Also, another question would be the person who goes on this lifestyle diet, ketogenic, as an intervention, will they be able to come off their SSRI by doing this?
Yeah, great question. So SSRI is one of the most common prescribed medications for anxiety or depression. And it is something we love doing at our clinic, is actually helping people get off these medications when they no longer need them. And fortunately, we do see that as very possible with this intervention as well. So definitely doesn't mean everybody ends up coming off of it, but absolutely I have helped people get off of it. And it's something you really do want to work with a doctor to do. These medicines, the body can get very accustomed to. And so it can take sometimes months to really taper off of them. So it's not something you want to stop cold turkey. Even if you were feeling really good on keto, if you were to stop that medicine abruptly, you could have some really nasty withdrawal symptoms and feel very poorly. So make sure you're working with your doctor to do something like that.
Thank you for that. Another one is, well, I mean, we kind of know the answer to this because we kind of have to deal with it in the practice on a regular basis. But do we see a change in the way physicians are practicing mental health because of these studies that are coming out? Is it having an effect? And what is, how is it being taken for the people who are not in the low carb medical community, let's say, and how can we pass on this message to them more powerfully?
Yeah, great. So I think actions, we definitely see more physicians, practitioners who are interested in low carb, but realize not only for the metabolic benefits, but see the mental health benefits on a regular basis. So I think that is becoming accepted, acknowledged. I remember when Tro and Brian used to talk on their podcast 5 years ago, they said people were, they were making things up, did not trust them. But now it's actually very well accepted that the nutritional interventions can be very powerful for mental health. The Metabolic Mind, which I had a link to at the beginning of the presentation, and the Bazuki group are doing some awesome work to try to increase awareness, start clinical trials to get more evidence out there, and to give these types of interventions like treatment options instead of medications. And so they have an amazing story. So I do encourage anyone interested in this topic to go to metabolicmind.org. That is a wonderful resource. There is a lot more work to do, as I just mentioned, with the Maryland Department of Health shutting down that inpatient study using a ketogenic diet therapy for schizophrenia. So hopefully they will reverse that with enough people pushing back and trying to emphasize how important this is. But I do even see in some people in the residency setting on faculty who are starting to open up their mind to this type of information. So I think slowly we are seeing the ship turn, and that hopefully within the next several years, metabolic psychiatry is going to be a common term.
And I think somebody had put in the chat, and for sure I have to agree with them. I mean, that they listed as Chris Palmer's Brain Energy book is a great read. So for those of you who want to dabble a little bit deeper into the topic, that's a great read. And the most recent one that came out also was Change Your Food, Change Your Mind by Dr. Georgia Ede. That's another excellent one. It's a very smooth read. You don't have to be technical about it to understand it. Very well written, and it does get into good detail. It's an excellent book. What just happened here?
I saw another one. My friends are skeptical. Does keto cure everything? So it's crazy being in the medical field and seeing patients with all sorts of different conditions, from liver health concerns to reflux to mental health concerns, premenstrual symptoms, really uncomfortable menstrual periods themselves, all the hypertension, diabetes. I mean, the list, I could just keep naming things. And yes, we do see them all get better with keto. It's almost too good to be true, but once you see it, you can't unsee it.
Yeah, I think it's something that we all get pushed back on. I mean, it's hard enough to get them to accept that the ketogenic low carb lifestyle is addressing metabolic health, and then when you start telling them that it's also has its place on the mental health side of things, they really start. I mean, it seems that that's even like now now we're pushing it too far, sort of a deal. And like that comment says, does it cure everything? Well,
Yeah.
maybe not cure everything, but it does come very close from what we're seeing. So yeah, it's something we need to deal with.
Yeah, and I mean, there's one of the things that it's very well accepted now in the medical community is that a ketogenic diet can have significant improvements, oftentimes putting epilepsy into remission for many children, even adults. Now there's some more data. And so it's not far-fetched that if it's treating that condition stemming from the brain, that it could also be treating some other mental health conditions. And I mean, that's what we're seeing too. And there's now much more evidence to back that up. We just need to get the evidence out there and keep doing larger clinical trials in people.
Yeah. So, Dr. Laura, would you encourage somebody who does have, let's say, somebody that is going through this type of a illness, and they're being treated, and their physician is really not, on the same page? Would you encourage them to print out a study like this and give it to their physician?
Absolutely. 100%. This is something we need to be helping people with. And if your doctor's not supportive of it, maybe find a new doctor. It is something where if you do have one of these medical conditions, I would get help from someone who can help either titrate medications or just monitor symptoms while you're making these dietary changes, because they can be very powerful. So you might need some medication adjustments. But hopefully, like you said, Vic, if you print out these studies that are coming out, print out both ones I just reviewed tonight, that should be enough to hopefully get your doctor curious, maybe start looking at some more data and try to help you with that, or find someone who could. And there's on the SMHP's website, the Society of Metabolic Health Practitioners, there is a directory. So you can type in your state you live in and find other doctors who kind of practice low carb or other practitioners. Tro and I are licensed in almost all 50 states. So if you're not able to find someone to support you, we want to help support you on your health journey. And yeah, so we are here, and the SMHP is also an excellent resource.
Yeah. And Laura mentioned here that her son had seizures about 6 years ago, and his neurologist did recommend the keto diet as an intervention. So I
That's
guess
awesome.
the word is starting to get out, right?
Yeah. Yeah. Very cool. Well, any other questions?
Can you put the titles of the papers in the website? We will post it. We'll post it on the app, and we will post it. I don't know. I guess I'll take care of that to make sure that we have it mentioned somewhere and point you guys out to which part of the app to find it in. I
Awesome.
believe I believe we were talking about that, right, Laura? To get it up in a certain section in the app.
Yeah, I think we would like to. And I'll also maybe just post in the community chat the pictures of the titles of these two papers that we reviewed.
Awesome. Any other questions? Any other questions for us?
Yeah. All righty. Well, thank you so much for spending your Tuesday night with me. And we're actually not going to be doing Journal Club in 2 weeks. We typically do it every 2 weeks, but we're going to be having a guest speaker who's going to be talking about Parkinson's. So that should be really great, some really interesting information. And then we'll be on to Journal Club number 4. If anyone has any specific articles they came across or think would be really good to review on our journal club, please message it either in the chat or just in the Toward Health app in the community chat, and you can tag me in it, or you can respond to the Twitter post. And anyway, and we'll try to see if that's something we can review.
Awesome. Thank you so much, Dr. Laura.
All right, my pleasure. Good night, everybody.
Night.